It's time for good energy, and I'm Dr. Julie, and welcome to Bodyful Day 371. We are talking about low back pain and the senses, and today we're talking about the sense of touch. So our goal through this series has been how to use our senses to either identify stressors that are causing our low back pain, and to use our senses to help heal or provide energy to heal from back pain through good energy in. So join me today as we're going to look at the sense of touch, in particular places where we can hold, use pressure, vibration, or temperature changes to help improve our low back pain. Go ahead and take a deep breath in and release. Deep breath in, expand in the belly, expand in the chest, expand in the sinuses, and release. We're talking about the sense of touch, so think back to a massage or think back to somebody working on your back for you or sitting in a massage chair and how that sense of vibration, pressure, or temperature helped your low back pain. Take a deep breath in and release. So today we're going to work on two major stabilizing muscles on either side of the low back. So the first one is known as the quadratus lumborum, but in common conversation it's known as the flank muscle, or even if you are a hunter, it's known as the back strap. It is these muscles that line your low back that start up at the rib and go down to your hips. And they're just two wide stripes. And they should be supportive to help your hips lift up and down as you walk, but they shouldn't be doing the whole thing. The majority of that actually should come from a little muscle that sits on either side of the hips. So today we're going to work on trigger points in the quadratus lumborum as well as trigger points that occur in those little muscles on either side, which is called your tensor fascia latae, or otherwise known as the TFL. The TFL is supposed to be moving your hips up and down. We call them the hip hikers. But when the TFL doesn't work right, then the quadratus lumborum, which are those flank muscles, must take over the role. But the problem is that they're really not designed for that task. They're designed as helpers, not as prime movers. These little muscles on either side of your hips are actually supposed to do most of the work. And so when you have a hip that's out of place, that prime mover shuts down and the QL on the opposite side has to take over. And so what you have to do is you have to release the trigger points in and around. Now, a trigger point is a point where the muscle has knotted due to injury, overwork, or a misalignment of the skeletal system. And that can cause overwork and injury. And so with a trigger point, what we want to do is we want to hold, we want to vibrate. I brought out my trusty little vibrator here. Hold, you can hear that, hold, vibrate, or provide heat or cold to that area. It's hard to pinpoint heat or cold, so usually in this we're working kind of the massage acupressure approach to releasing these muscles. So how are we going to get in there? Well, first and foremost, you got to find your hips. The top of your hips here are where everything happens, and these are the tops of my hips right along the side. If I'm going to start releasing that quadratus lumborum, I am going to slide about 2 inches back. And 2 inches back if I push right in. So you'll notice here's my hip. I slide my 2 inches back and I push right in. Like I just kind of want to go right across. And that is the tendon that inserts to the quadratus lumborum. That's where the quadratus lumborum inserts into the top of the hip, and just pushing straight into it, literally just going straight across, is a great way to release tension in that muscle and any trigger points that exist along the bottom edge. Now, likewise, you can use your vibrating tool and just kind of dig in there. Notice that I'm, again, just digging right along that edge. So not right in the middle because there's not much there, but just go 2 inches back and you can just kind of hold that area. There are a lot of patients that talk about issues with moving one hip or the other, and pain kind of going at an angle, kind of going from the bottom of the hip up into the back, that's that quadratus lumborum, that's that flank muscle. And just sticking a thumb, sticking a tool, you could use the handle of a wooden spoon and just stick it right in there, and that will actually release that tendon and allow the hip to move a little bit better. Now, let's say that your left flank muscle, the left side of your hip, the left side of your low back is what hurts primarily. And when you stick your thumbs in, where you find pain is on that left side. The right side is like, yeah, whatever, you know, it's a little tender, but it doesn't really bother me. The left side is painful. That tells you that the left flank has been doing a lot of work. And so you can continue to hold that, and you can also look for its other release point, which is up at the lowest rib. So if you come down and find the lowest rib, again, that's about 2 inches back, and again push in, that is the upper attachment of that QL, or quadratus lumborum flank muscle. It's also really close to the kidneys, so if you got any kidney annoyance or small intestine annoyance, this one will not feel good either. But again, it also is a trigger point that releases that muscle and gives that muscle a little extra wiggle room. All right, so left side, that's how you handle releasing that flank muscle. Start at the bottom, start by the hip bone, move straight across, push in, and then you can go up, find your lowest rib, move across, push in, and that will release that flank muscle a little bit. But remember, I said this muscle should not be doing the hip hiking, but it is. So now you got to go over to the other side, to the TFL, which is grumpy, because it should be doing most of the work. So again, find your hip bone. Hip bone is here, and then just work along the top edge. Start at the very front of that top edge and kind of just work your way up. You're underneath that hip bone and around. And you're gonna find some fun stuff in there. By fun stuff, I mean painful. Again, that's pressure. You can use vibration just underneath that hip bone. And that helps that TFL, hip hiking muscle, work a little bit better. All right, so you've got 2 ways to help with low back pain in relationship to touch based on pressure and vibration. As I said, you could do heat and cold. That's a little harder to do, is to apply little bits of heat and cold, but working just underneath the rim of your hip bone, as well as finding the middle of your hip bone and working 2 inches back, and finding your lower rib and working 2 inches back. And that will help release tightness in the low back and help improve your hip hiker function, which should take a little bit of stress and strain off your low back. Now, can touch act as a stressor? Yeah, it can. When I was a kid, I had fibrous cysts that existed just in the back on my spine. And I would twist my back a little bit so I didn't have to lean back on that fibrous cyst. And that was the sense of touch causing me to alter my posture. And that, of course, can put stress and strain on your lumbar spine. If you are a wallet carrier in your pocket, that also is a sense of touch that will alter your spine, and whichever hip you stick the wallet on, you will sit slightly differently. And that will again alter the spine and then cause stress or strain in the quadratus lumborum or the TFL that it is associated with. So the sense of touch can alter and can cause your low back pain, mostly because of consistent issues. So check your car, check what you sit on in your car, check where you sit at work. If there is something poking at you, or you're always shifting away from something because of how it feels, that is most likely going to cause some low back pain as well, especially if it's in the pelvis and you're making minor shifts down here. All right, I hope you have learned a lot out of this series, and I hope to see you back here next week. I was gonna start sunburn next week, but it's not sunburn weather yet, so I'll save that for the end of the month. Have a great day. Let's finish this off. Take a deep breath in and release. I'll see you back here tomorrow. Take care.